the owner and founder of a full family practice, which goes from 2 days old to 97. You have a 97-year-old patient currently.
She did have to stop care. She became a little
okay. Understood.
Yeah. She was under practice up until about 4 months ago.
Wow. Okay. So we really do go to 97.
Yeah, we do.
They specialize in non-stem chiropractic, and as a chiropractor, Dr. Moore focuses on finding and correcting any subluxation.
You nailed it. You nailed it.
Thank you.
Yeah,
that is present in the nervous system and that is impairing optimal function. So Dr. Moore is a member of the International Chiropractic Association, Indiana Chiropractic Association, Gonstead Clinical Studies Society, and Gonstead Seminars. So he serves on the board of directors with the International Chiropractor Association of Indiana. So join me in welcoming him.
All right, good afternoon, everybody. It's been a good long day so far, hopefully. Full of a lot of information. Everybody kind of a little exhausted post-lunch, maybe. I will apologize, I am gonna have to pick that up occasionally to go through my notes and stuff like that, just based on kind of how the screen goes and stuff like that, but we'll go with that. Are we one session after lunch? Because we're gonna do an activity where this is the second session after lunch. Yeah, and this is when kind of the lethargy, and I even see it in the eyes. I am a very interactive talker, so please, we can ask questions I have a full section for that, but some of the stuff is going to be kind of give and take, and I'm going to want some interaction, give me feedback, kind of what's going on, and if you even have questions as I'm going through, throw that hand up super high like you got to go on a pee break, and I will call on you, and we'll kind of stop and go from there, okay? So let's do something interactive, because everybody's blood sugar's hitting a little bit, everybody's kind of getting that afternoon tired, and it's beautiful outside, so we're all a little jealous. Everybody stand up and let's just do some 10 air squats, just nice and easy. We're not breaking a sweat, we're just moving, we're getting our bodies moving. This is gonna be one of the slides anyway. Why? It's so important. I don't care if you go up, down, side, and side. You guys have been sitting all day, right? That's not what's good for the body. MC, great job back there. I can see you doing it. All right, everybody looks like they're ready now. Now I see smiles, see? The blood's flowing, everybody's ready to go. So MC, we can go to that intro slide. You're still going, I love it. You needed more. So a quick introduction on myself. I find introduction slides really weird. You clearly had some interest in me, and so now I'm gonna all of a sudden flex everything that I've accomplished and stuff like that. So what I put up here is actually the stuff that means the most to me. And that's my family and my practice. My family, I do have a wife and 2 kids and our awesome dog right there. His name is Warren G. And if any of you like 90s hip hop, yes, that is why our dog is named Warren G. So that's a little introspection into who I really am. But our kids, both of them play lacrosse, and I am so happy to be here, but I am a little yearning. I'm also the high school coach for lacrosse and assistant coach, and they're down in Evansville playing right now, and they won their first games yesterday, and today they're playing right now. So fingers crossed that they do well as well. And then that's my practice right there. Oh, not yet. That's okay. That's my practice down there. Dr. Dan is my associate. He's been with us since last year. Another Gonstead doc. We brought him in because of our growing practice. And then we have my wife and 2 front desk staff, and then a woman, Kelly. She helps us with exams and x-rays. As MC,
Where are you located?
Thank you so much. In Zionsville. Okay. Zionsville, Indiana. Yep. So a little bit about me, and I'll shine the brass that's on the chest and stuff like that. I am a Gonstead doc. That's all I've ever practiced. Gonstead kind of specializes in being as specific as possible with chiropractic care. We'll kind of go through what that means and what it is. I am president for the ICA of Indiana. That's a state association for chiropractors, so I get heavily involved because I care about my art. I was in another profession, tax and accounting. Yikes. Yeah, yikes. That's okay. That's okay. Didn't have that reaction. It was great, and one of my staff members loved it, and that's what I saw, a passion and a love, and I had to go to something that I truly feel passion and love and a way to give back to society. And I knew this was chiropractic, so my wife and I left downtown Boston with 2 little kids and went back to school in a terrifying way to middle of nowhere, Iowa, to go back to chiropractic school. So I am president of my state association. I'm heavily involved with Gonstead Society. I am also involved with the International Chiropractic Pediatrics. Association and certified in Webster Technique. And then I've also served on the Chamber of Commerce for Zionsville for about 7 years now, as I love community and kind of bringing all of this together. So that's why when Melody Gandy back there kind of put out for me to speak at this event, I didn't even hesitate. So thank you all for having me. That's a little bit about myself. We can go to the next slide. Legal disclaimer. Ooh, already. The legal disclaimer on this, one of my patients actually practices in family care, and him and I had a nice sit down, and he was kind enough to kind of talk about this, and these were the 2 sentences he said to put on the slide. Basically, everything that we're going to talk about relates heavily to chiropractic care and some additional things. If you're fostering a child, there are court documents that say what can and cannot be done with that child. As a result, always reference it. It is not there for fun, it is there for legal purposes. So, if there are a lot of gray areas, go back to the court. If you say, hey, I want this child under chiropractic care, I think it would benefit, and it doesn't specifically say, go to the court, talk to the lawyer, get that cleared up. As a provider, that's that next bullet point. If a child is being fostered, I would like a copy of that, please. While ultimately the onus is going to be to the foster parents for bringing them under care, it's still going to make me sleep at night. I want to continue to practice. I want to continue to care for all the families that I see. Please let me do that. So bring that document, okay? That's the only big legal disclaimer. So, why does this matter? Does anybody have thoughts like why chiropractic care and why I'm here to help support foster adoptive parents and most importantly the kids? Sorry, I love you all as adults, but it's mainly the kids. Anybody thoughts? Yeah.
Because when you align your nervous system, it makes them behave better.
Oh man, we're best friends. Yeah. So she said when alignment's going to help kind of regulate behavior. Who, again, and I don't know the demographics of everybody out here, so let's go outside and of saying normal child behavior. We're talking outside of normal child behavior. So if you've adopted or if you've fostered, who has seen the extreme? Who's seen the extremes, right? The extreme tantrums, the extreme anger. I'll say it right now. I have been bitten, I have been kicked, I have been spit on, I've been punched once. As I joke, you get one. You're only gonna get one on me. But I have been. In my office. This is the extreme. This is a dysregulated nervous system. This is what chiropractic concerns itself with. How do we properly regulate the nervous system between brain and body, and the part that everybody forgets, body and brain. It goes back the other way. It's not just one way, it's a two-way street, okay? So this is so important in this realm because a lot of these kiddos, and lest all of you forget, you're all wonderful people, look in the mirror. It's impacting you guys as well, okay? Please, I hope all of you have heard of the airplane and mask analogy. If not, here it is today for the first time, and you're welcome. What does the flight attendant say if the air masks fall down during the flight? Put your mask on first. Why? Is that selfish? No. No, it is not. That is how everybody gets helped. You can't help that child if you're not helped first. Okay? That's a big thing to remember as we are talking today. Because I'm going to be talking a lot about the kiddos. It impacts everybody in this room, and then some. We'll go back to my logo later. It's a leaf with a spine hitting water with ripple effects. And that was very intentional how I designed that logo. Because it's that ripple and the impact that then happens and goes across the board. So again, talking lots about kids today, but I hope everybody's listening just a little bit about themselves too, because this impacts all of you, okay? So we kind of talked about, everybody's kind of noticed the big emotional outbursts. We've all kind of seen these things. We've seen physical things, we've seen emotional things, we've seen social things. We often gravitate those things towards psychological, right? Why is the child doing this? What is the implication? How does this impact them? How does it impact their classmates? What about the physiology? Yikes, we kind of forgot about that part. What's the psychology of an infant? If somebody has an idea, please, by all means, I would love to be educated on that, because I don't think we do. But we sure do know the physiology. We could get really nerdy into epigenetics today, and I could put you all really asleep quick, okay? And I don't know what you all know about epigenetics. Genetics, my kind of analogy, I am, as I said, a dad. I love sports, so I speak in analogies. Genetics to me are like light switches. You're born with them or you're not. Epigenetics determines whether they turn on or off. Perfect, okay. So let's get nerdy for a second. I won't bore you too quick, it'll be quick. Epigenetics start when you're an embryo in mother's ovaries when she's in utero. Yikes. That's a yikes moment. That's genetic code. Okay, so we're constantly getting thumbprints throughout her experiences, and then we develop in utero. We haven't been born yet, but we are certainly undertaking experiences, and then we're born, and we sure get a lot. Okay? So that physiology that's constantly happening is going to have huge, God bless you, going to have huge imprints on every single person. And the question isn't what happened, it's how do we get better? Because I think that's something that gets lost. And when I say these things, I'm never throwing stones, but if we hang up, and Melanie and I, and Dr. Dan and I were just kind of talking about this, what often gets hung up is, let's find the smoking gun, right? Like, what happened? How do we unravel that trauma of what happened in that occurrence? And there are certain benefits to that. But that physiology of that child still has huge potential to heal. And maybe nobody's ever told some of you that. And I'm sorry if they haven't. There's huge potential for the body to heal. That's what we're doing on a constant basis, right? The body wants to do two things in life, kids, on a biology stance. I won't talk about one of them. The other one is survive, okay? The survival mechanism is the healing action, okay? So that's why so much of this it matters. As you can tell, I get really passionate about it because I just don't think enough is talked about healing and the different ways to do it and the way that we can do it actually internally, given what we have in our innate, just with the right parameters. Okay? We can go to the next. Title. There it is. Autonomic nervous system. We're going to have to go a little nerdy for this. Yeah, I said I wouldn't bore you guys too much, but we do have to do a little science. If everybody, everybody loves science here, right? Amuse me. Yes, we love science. Okay. The autonomic nervous system. So the autonomic nervous system, autonomic sounds just like automatic, right? It's kind of the stuff that's happening on a constant basis that we don't think about. It also helps dictate. Most of us have heard of fight or flight and rest or heal. And we often think fight, flight, or, does anybody know the other one? Say it again. Freeze. Perfect, thank you. So there's fight, flight, or freeze in the sympathetics, and then the parasympathetics is how we rest and heal. Now, that fight, flight, or freeze, let's talk about that for a second. And again, let's relate it back to the child. Infant, we'll go into infancy, we won't go into in utero and kind of exhaust somebody's brain to think of how that's actually impacting. We'll say infant. Infant undergoes trauma. Can the infant fight? Can the infant flight? No. So there's only one left, kids. It freezes. Interesting. So, when we start with early trauma, the body chooses freeze. Now, who here understands what a neurological pathway is? Yes. I love this group. A neurological pathway, we'll go back to analogies. It's like driving home the same way every single day, right? We all have done it, we've all gotten to our driveway and gone, uh-oh, how did I get here? Those are neurological pathways. They happen over time. And they get deeper each experience we have that results in the exact same thing. We drive home the same way, we get to the same house. We drive the same way, we get to the same house. Guess what our body has adapted to? That. Trauma's the same. Experiences are the same. Dr. Dan has worked for me for, has it been 8 months, 7 months, something like that. Dr. Dan and I have a great relationship. In case he didn't know that, now he knows. When I see Dr. Dan, what's my initial response? Smile. This gentleman, I don't know who you are, but you're fully interacting with me and you smile, so thank you very much. Yeah, I smile. I give a big smile, and that's based off my prior experiences. Perfect, that's a neurological pathway. So, if an infant has experienced trauma, a multitude of different ways, and it has chosen the only thing that it gets to, freeze, which neurological pathway is going to be the deepest to your kids? Freeze. What's another word for freeze? Anybody have one?
Fawn.
Say it again.
Fawn.
Oh, you're going big words.
What?
You're going deep in the definition. I'm going to choose a very common societal one. Anxiety. Ah, yes. Yes, everybody, yes, yes. Anxiety. Anxiety is that notion that's our spidey sense. Also a little something about myself, I love comics. So it's our spidey sense. Kind of going, uh-oh, danger, Will Robinson, also a reference. So it says something's off. Now if an infant notices something is off, again, we're going right back to that freeze. What about once they become a toddler? How about teenager? How about adult? Has that changed? Has it been given a chance to change? I don't know. But that's why we have to kind of understand the autonomic nervous system and what's going on here. Again, we can't go back in time. If someone has a DeLorean, again, a good reference, I will happily go in it and we will hit 88 and see what happens. But my guess is nothing. And so as a result, we can't go back in time and we can't change those things. But we can at least kind of understand where that human is, what they've experienced. Melody has graciously allowed me to use her son as an example in a case study today. So I will kind of weave that pattern in and out. I will talk more about a couple cases at the end. But Dallas is born with narcotics in the system. I love that child. I would go back in a heartbeat and change a lot of things if I could, as his practitioner. But I can't. But that does help me understand. And again, through his care and Melanie and I really getting to know each other, she's provided me more and more information. Again, it's not so that I can go back and change anything. It's so that I can understand what he's kind of undergone. I can understand the trauma that his nervous system has had, and we can start to unravel it. And that's kind of what a good, specific chiropractor is going to do for the patient. So, we kind of understand the autonomic nervous system now. You're all neurologists. I love it. That's great. We kind of understand that fight, flight, or freeze, rest or heal. Let's talk about the other side. Now, as I said, besides that other thing, our bodies want to survive. Perfect. That's why we have this system in us. So that if predator is coming upon us, I throw a tiger in here. Don't worry, there's not. That would be a terrible, fun game. But if we had a tiger in here, we would all hit true sympathetic overload, right? I'll give everybody the benefit. We all evade the tiger. Great story. So, we evade the tiger, then what happens? Again, interaction, come on, guys. What happens after we run away from the tiger?
Slowest person gets eaten.
I told you I liked you. Did you figure out who it is in the room? No. Okay, so once we all evade the tiger and we all get away, our parasympathetics kick in. Our rest and heal kick in. That's what I was looking for, thank you. Our rest and heal kicks in so that we can actually heal from that trauma that just occurred. So guess what? In case tomorrow we find another tiger, we can survive again. Now, I can't wait to see if there's a hand. Who here is running from tigers on a daily basis? Okay. Thank God no one put a hand up. We would have dinner tonight, and I want to hear the stories. No, so nobody's actually running from tigers. So what things do we go through on a daily basis that feel like it? A lot. A lot. And again, I'm talking lots about the kids, but I'm talking about you guys too. So let's be really openly and honest. What have the past 5 years been like? I don't care what side of the aisle you're on, where you stand, upside down, sideways if you're in the other realm. The past 5 years have been bananas. Stressful. Not running from tigers though. So, we don't hit that sympathetic ceiling. If we don't hit the sympathetic ceiling, we're in this chronic burn. And we never have that parasympathetic rebound. Uh-oh. So we never actually get to that healing place. Let's go back to the kids. Are they getting there? Often, the stances of trauma are continuing. I'll go back to my buddy Dallas, and I will try not to get emotional. I am an emotional human, even though my wife will tease me sometimes. I don't show it often. But when I talk about this stuff, I get very emotional. That poor child continued to experience the trauma. So when was he going to heal? The moments he was in the Gandhi's arms? He went right back to the trauma after that. Yikes. So we're not healing. We're not healing as kids. We're not healing as society. So that's kind of understanding, like, and I don't mean to be so dystopian. There are other slides. The presentation doesn't end here. Like, oh, good luck. No, we're going to talk about how we fix this and what we do. But the point is, I just want kind of everybody to understand that, because that next word right there, dysregulation, that's where we end up. Stuck in one mode, or that switch goes really quick back and forth. Really quick back and forth, right? Like we've all seen those. Again, use my buddy Dallas. And Melanie and I were just talking about it. That little dude put one right across my face. Put all 5 fingers open. I told you, I've only been hit once. And it was not by Dallas. But I got 5 open fingers across my face. Yikes. What happened? Nothing. That kid hugs me every single time he sees me. But something he was not happy about. I think that day was that I was running late. Probably. I wasn't on his time schedule. And that's what set it off. So that's dysregulation. And that's what we have to recognize. Because the next part is understanding how we regulate. Okay? So we can go to the next slide. Flip over. So, this is just kind of a nice little chart. Kind of shows hyperarousal and hypoarousal. So it kind of allows you guys to understand the different states that these kids, and maybe sometimes yourselves, are kind of stuck down in, right? Like when we're hyper, like that's when, like I said, I use that word, anxiety, panic attacks, frustration, constantly yelling, fidgeting, racing thoughts, hypervigilance, right? Like we've seen the tickiness. That's the hyper. So what we call our sympathetics, the fight or flights, are overfiring, or maybe the parasympathetics, rest and heal, are underfiring. Transversely, I said we kind of get stuck in that state for long periods of time in a chronic burn, and we don't ultimately heal. We can dip down, right? So if we think of this room, and that, this is a great room to use, that green line is midline, and that's where we should be in a nice quiet state, right? Like right now, hopefully you are all somewhere around there. Hopefully this isn't stressful to any of you guys. If the tiger comes in, we hit the ceiling. Tiger leaves, we hit the floor. But most days, like I said, we're not having that tiger experience, so we're hovering somewhere between that green line and the ceiling. We hang out there long enough, which is really bad. We actually get pushed below that green line, and then we kind of go into that hypo. And that's kind of that floundering in parasympathetics. And when we get stuck there, think much more on the opposite side. Like, what's the opposite of anxiety? Typically, like lack of emotion or depression. And kind of getting stuck in those states for long periods of time. Now again, true dysregulation, which we see a lot, in heavy trauma-based kids, is dysregulation that they're going quickly between the two of these. And that, I would say, is kind of the most concerned state that I see, because those ones, their nervous system isn't just stuck, it's floundering. Okay? So, you can go to the next slide. Ooh, there it is. All right. Brain and body, they're kind of important, kind of connected. As that lovely woman put back there, right? Alignment. That's what I'm going to talk a lot about. Talk about chiropractic. Because let's understand a lot of things as chiropractic, and you all seem a bit more educated than the layperson out there, because you've already given so many good answers. But for most lay people, when they hear chiropractic, they think of thank you. Oh, so you went there, that's okay. But pain and neck popping, or popping, and all of those things. And are there benefits to pain regulation and sports performance, right? Like every NFL team has a chiropractor. We love saying that as chiropractors. And most professional teams do. Yeah, for sure. Like there are great things from that. But that's not actually why or what chiropractic is. Chiropractic is actually getting the brain and the body to communicate in a better fashion without any impedance or any interference. Well, that seems simple and that seems kind of cool. Yeah, and that's what it is. And why that happens is as that body undergoes all of that stress, here's a quick tangent, stress is physical, stress is chemical, stress is mental, right? There are those three buckets. And the body does not recognize or disseminate which is which. It doesn't really care, right? It doesn't really understand if you were in a car accident or if you imbibed a little last night too much, or if you just lost your job. All of those types of traumas the body's going to recognize very similarly. So as a result, the next thing the body has to do is adapt. Right? Because like if we just shut down with every stressor, none of us would be standing here today, right? That's the laugh. Right? Like none of us would be here. But our body is healing and our body is adaptable. Again, I said the body can heal itself as it's supposed to. So why does it not sometimes? Or why do we start to express symptoms beyond somebody else that went through the exact same thing? Right? Like you and I can have the exact same experiences, and we both can agree we're going to respond differently, right? And so the question is why? And it really comes down to adaptation. Is our body adapting to the stress and then ultimately healing? And that's how chiropractic is going to approach it. Now, a quick disclaimer. Just like any profession, there are always good and bad in every profession. So when looking for a chiropractor, I always recommend you find one as specific as possible. That doesn't mean finding one person. That means a chiropractor that is going to do a heavy examination, a heavy analysis before they ever deliver an adjustment. That's why we use what's called the Gonstead technique. That's why we're heavily involved with the pediatric council, so that we continue to improve upon those things and constantly research and learn. And Melanie and I were just talking about, I just had a little one coming to me from Terre Haute. From those of you that don't know, it's about an hour and a half, door to door from Zionsville to Terre Haute. That's a drive. The first appointment, the parents were like, we almost turned her down. And I'm like, I don't blame you. The kid was crying the entire time. She was 13 months. And so I was like, look, start with me. I'm going to call and research a number of the chiropractors down there so that I feel comfortable sending you to somebody that's not just, somebody off the street. I want them to be understanding. And I called 3 chiropractors. And the first 2 were like, I am not comfortable with that case. Those are really good first 2 chiropractors. Because they weren't comfortable with the child and what was going on with her. Third one was very comfortable, and the little girl's doing very well with it. So the point is, always look for a good chiropractor that kind of understands this stuff, and you'll have my contact at the end, so even if Zionsville's a long drive and stuff like that, and you want chiropractic care, reach out. I'll find you somebody. I'm happy to. So, let's go to, again, chiropractic care as far as what it actually does now that you've heard my tangent of why it's important. So, if the body fails to adapt to those stressors that the body is undergoing, it's going to happen around the spinal column, around what's called the spinal nerve root. And it starts to disrupt what's known as a feedback loop between the brain and that area. When the body is under duress, right? I'm not going to again, this is not an example I'm going to show you, but if I can hit my hand on something, well, I guess I did earlier, that's why I have a cut there. My hand would swell up, right? Because the body's gonna send inflammation to that area. Now, inflammation gets a bad rap these days, right? Everything needs to be anti-inflammatory. Now, you should be, it's true, right? Take down inflammation. Inflammation is a necessity by the body to repair and heal. When it's supposed to. If the body's failing to adapt, it inappropriately sends inflammation. It would almost be like systemic inflammation, right? If we're systemically inflamed, bad, no bueno, not good. But if our body is failing to adapt and the brain and the body recognize that as an injury and starts to send inflammation, that's also not good. Because what happens is it disrupts that feedback loop between the brain and the body, putting pressure on the spinal nerve root. Again, nerdy for a second. The spinal nerve root only needs about the weight of a dime to change function. That's it. 10 millimeters of mercury for those playing Jeopardy. That's it. So not much.
Thanks for the metric.
Absolutely, you're welcome. Science is only based on metrics. It just makes more sense. Can we just admit that? So it needs very little pressure to change that nerve. And the moment that nerve changes function, all bets are off. We actually don't know how that nerve is actually going to respond. We just know it's not ideal. And not ideal is not what we want. We want optimal, or at least that's what I want. I want for myself, for my own family, for my friends, for all of you, now that I've met you, I want optimal. So, we need to check that to see, because as soon as that nerve starts to put pressure, it then creates what's known as a negative feedback loop. So we have good feedback loops, that's brain and body connection, but now we have a negative feedback loop. Because the brain recognizes that area hasn't been repaired or restored, and so it continues to cycle that inflammation. The more and more it continues to cycle that inflammation, the more changes we get to that area because that nerve is acting differently than what it's supposed to do. So again, as a chiropractor, that's what we're looking for. We're not looking for neck poppy things. A good chiropractor is going to use instrumentation first and foremost. Instrumentation not to adjust, I'm still at the exam here. An examination and instrumentation to find what is actually irritated and kind of what's going on subcutaneous. What's going on in that area. That doesn't always mean x-rays. We don't x-ray until certain ages. We do use x-rays in our system, and I will tell you, I have x-rayed little ones. Typically, 8 to 10 is when I start about to x-ray. A 5-year-old came in, on spectrum, cerebral palsy, etc., etc., etc. There's a lot of neurological stuff going on there. I want to know. The parents want to know. That girl doesn't understand it. She wants to know. She wants me to give her the best adjustment. That's why we take that information. But the first part of the exam should always start with looking to see where that inflammation is on the nervous system, where the body's starting to fail to adapt. Good. All right, yep, stay right there. So once we've found that, that's when we do more of an examination, and that's when we start to actually consider, do we need to make that adjustment? Because what that adjustment's actually going to do is take that pressure off that nerve. So that negative feedback loop that's been occurring, it breaks that cycle. Again, TikTok, YouTube, has not been kind to our profession. So let's just say that, okay? Because they put a lot of ASMR, as the kids say, things out there where they hear these clicky and poppy things and all these different things. And that's just for clicks. That's clickbait, guys. A good chiropractor is going to adjust appropriately to one segment. Not twist it like a pretzel. It's one segment, contact that segment, adjust it. As soon as that pressure starts to come off that nerve, now we have reestablishment between brain and body. And as I said, the part that everybody forgets, body and brain. This is Dr. Heidi Havik. She's a chiropractor somewhere in Europe, I don't remember, so please don't quiz me on that. Brilliant woman. She predominantly focuses in research. She doesn't do a lot of clinical care anymore because what she focuses on is all of the changes in the brain that results from chiropractic care. So she has done a number of studies showing EEGs and improvement pre and post adjustment. That's big, guys. That's big, because that's ultimately going to, again, elicit that healing. We often think of the outside, right? Like, Oh, how's the outside functioning? Oh, well, I brought my kid to a chiropractor because he wasn't pooping, right? Like I get those cases all the time. My kid's not pooping. Can you do something? There's no poop button. That would be awesome. But why do most kids start to poop under care? Not because there's a poop button. I'd walk around right now and do this to somebody and it'd be really funny. It would. It's because we're taking that pressure off that nerve and the body's now functioning the way it's supposed to, and that's what's supposed to happen. And while those parents are looking predominantly at that symptom, and that's why that couple was driving from Terre Haute to Zionsville was because their daughter was toe walking. That's what they were concerned about, right? They were concerned about toe walking. This can't be good developmentally. Something's off. As we even found on examination, the child also couldn't lay on her back since birth. And so mom and dad were literally holding her to change her diaper. Like, how good is that mentally for them? Like, that has to be terrible. Under care, I saw her 6 times before I found her someone in Terre Haute. She was flat foot walking and she could lay down after 2 adjustments. And that's, again, not looking for patting myself on the back. That's the power of chiropractic. It was, her body started functioning better. And again, like, those symptoms are really important to the parents. That's why they crossed my threshold. This is the payoff pitch, guys. This is the stuff that I don't even need you guys to fully understand, or don't even need all of my patients to understand. But the point is, the brain is improving under chiropractic care, and we have the data. That's why it's important. There, next slide, please. Oop, yep. There it is. Most people have heard of the vagus nerve? Yeah. Vagus nerve is really important in nervous system dysregulation. Okay, really, really, really important. I will tell you, as a huge nerd, in the lab, like going through the cadaver, tracing the entire vagus nerve is where you really get to understand it and how huge and important this thing is as far as the actual connection to the body. So again, it's an evaluation that we're constantly checking and testing because we want to see what the tone of the body is, how the body's responding to the adjustments, and kind of what we're getting from what we'll call vagal tone. So my sister helped me with some of the slides. She's very good at this presentation stuff. And she was like, please don't bore these people with vagal nerve tone. She's like, you're gonna go so off the deep end because you get so excited. I said, fine, I'll give them the slide. I'll go very briefly, and if they have questions at the end, we can go through them. So there you go, next slide. All right, so we've kind of already highlighted some of this stuff as far as chiropractic care and why it benefits kids and why I'm standing in front of you today. We know they shift from that hyper-stress state to that healing state. So again, to go back to my buddy Dallas, 5-finger palm right across the face. Adjusted. Different child. Melody, do you agree? Can I get it?
Yes. Yeah, and a big reason why because this is probably with every child, but being a foster mom and now adoptive mom of a child with significant trauma, I wanted to share the hope that I've received of having a child who hits, bites, slaps. I've watched him hit and slap, reprimand, and I've watched a child who's just so overstimulated and angry, throwing shoes at the wall, and then how it has completely calmed his system. And it's given me hope that he doesn't have to stay in a state forever, that healing of the brain is possible.
Thank you. That's why Dr. Dan and I show up every single day. Again, I certainly speak to it in the fact that I left a career, I was 8 years in and headed towards partner for the firm and headed to law school, and my wife was like, you hate what you want to do, what you do, and you still want to be a chiropractor? And I was like, nah, we live in downtown Boston with 2 kids and fancy things, I can't abandon that. She's like, yeah, but you don't enjoy what you want to do, and I can tell you still want to be a chiropractor. And that's why I show up to work every day. I love working with all my patients. I loved working with my 97-year-old while she continued to show up. She was one of the sweetest women I've ever met. Kids take a little bit more hold a special place in my heart. The changes that we get to see and facilitate with them happen so instantaneously. And the reason is, sorry guys, they don't have the decades, right? Excuse me. They don't have those decades, those heavy grooves of those neurological pathways that we already talked about. Because we get them healing faster. We get them to that state quicker. So that then their body can do what it's supposed to do, which is heal and thrive. That's what they're supposed to do. They're supposed to heal and thrive. And so when they're having those moments of not, again, we can't go back in time. Melanie and I were talking about Dallas and water and all those things, and it's like, we could go down that road of like, did he have a traumatic bath? I don't know. Dr. Dan brought up a really brilliant point. A lot of the trauma he experienced was in utero, which is a liquid state. Okay, maybe. We can't go back. That sounds terrible if we don't know how to heal from it. And that's why we do what we do, because it does help facilitate. Now, again, chiropractic is the start here, guys, because without a proper nervous system, our body doesn't process things appropriately. So that's where we have to start. So we can go to the next slide. Yep. Perfect. So, I already kind of alluded, we talk about physical, chemical, mental all the time. Chiropractic is what we do. So patients come in, we give them chiropractic care. The conversations we have are these things. Because these things have to be part of their lives as well. Good physical inputs, good chemical inputs, good mental inputs. That doesn't mean avoiding all traumas, man, that's impossible. And I don't want to live in a glass room. I want to experience life. Life has trauma. Life is going to be stressful. But we should be able to adapt. And moreover, we should put in a lot of good positive stressors, okay? So some good physical stressors. Melody knows I love crawling. Crawling. Crawling is so beneficial. Anybody want to guess why? You guys all got quiet on me? Have I been talking that much solely? All right, it's one of the first things we do, yeah? From a movement stance, crawling is one of the first things we do. It's actually cross-body connection. Oh, I'm showing you guys, here we go, here's how we move, right? It's that cross-brain pattern. That really starts to inspire that whole brain-body-brain connection. That's why crawling is really important. I can't tell you how many times Dr. Dan and I have seen patients, and I'm not talking about kids, I'm talking about teenagers and adults, and we check them and we go, you never crawled. And they go, I went right to walking. Or I walked really, no, my parents were really happy. I walked really early. I don't know why that's exciting. Once they go mobile, they never stop. Like, man, when my kids got mobile, I was like, let's have you sit down for a little. No, that crawling helps with brain development. And so sometimes we have to get back to that, especially when that step was skipped. And again, let's bring it back to the kiddos. Did they always get the crawling development that they needed? No. I'm familiar with both. So in my office, I have seen a number of kids that have been adopted here domestically and a number of foreign. And both have a lot of uncertainties, right? With like medical histories and stuff like that. Some countries we can surmise. I have a few kids that are adopted from China. Knowing the state of adoption in China, it's often thrown in a crib. Good luck. So they're not getting those physical developments, those early patterns. We got to get back to them. So that's why, again, crawling's up there. There's a few other things, but crawling is always like my number one. So is walking backwards, so is crawling backwards. It's why, right, weighted blankets. That's why weighted blankets are a thing. It's comfort, it's close. Notice what I put above weighted blankets? Yeah. That to me is the most important. That to me is like super, super important. Obviously, always with permission from parents and stuff. I'm a hugger. I think it's so important. I think we, again, I don't care where everybody was standing over the past 5 years. I think that's something that we were losing anyway as a society, and it's just gotten worse. We're supposed to have that connection. We're not meant to live in a cave by ourselves. Like, you all, for at least today, are my tribe. And so we're in this together. And so having that connection in that way is really, really important. So that's why on the physical side, adding these little additional things, highly important. You go next. Was there another one? Oh no, we went right to that. All right, this is still physical. I thought I was going to chemical. We'll stay on physical. So, breathing. I'm a huge breathwork advocate. I've practiced a number of different techniques. One technique I've worked on heavily for 8 years. It's so important. This is actually a picture of my nephew and myself doing some grounding and breath work 4 years ago at my parents' house in Massachusetts. Him and I were hanging out inside the house, and I was like, hey, Colin, let's go outside. He's like, I gotta put on my shoes, Uncle Nick. He's like, nah, not when you're with Uncle Nick. No. Let's go feel the grass, man. And he was like, no, I'm gonna get in trouble. I was like, it's fine. Uncle Nick gets in trouble all the time. So we went out there, and we were doing breath work. And his mom did freak out a little bit first, like, why is he without shoes? And I was like, because his feet never hit the grass. And they hadn't. That to me is odd. Like, again, we're supposed to have that connection to the earth. You know, again, grounding, thank God, has gotten a lot more popular. I dislike when things kind of become fads because then they kind of get thrown out. It's like, oh, that's fatty. It got popular for a reason. It works. That's why. And it's been around forever. Again, we're supposed to have our feet in the earth. Like, I'm not going to have everybody do it here. Thank you for this church for hosting us with this carpet. Wow, very nice. These aren't natural fibers, so I want you to do it more in grass. But we are going to do a fun exercise, so we're going to stand up again. Because we've all been sitting too long except for me. So, we're going to stand up, and we're just going to do a quick breathing exercise. You're going to find somebody else. You're going to emulate this picture. You guys are going to be holding hands. You need the connection. Yes. You're gonna find somebody, you're gonna hold somebody else's hands. And it's going to be fine, guys. Even if you don't know the person, introduce yourself first. It will be fine. So, has everybody introduced themselves? Everybody's got a partner. Alright, perfect. So, you guys can either do eyes open or eyes closed. We're just gonna do a specific pattern of breath work, the one that's up here. I'm gonna count it out. So we're gonna do nice and slow. We're gonna take 4 seconds in. We're going to hold it for 7 seconds. Yes, you all can do it, I promise. Okay, nobody freak out on me that you can't hold your breath for 7 seconds. You can. And then we're going to breathe out for 8 seconds. That's going to be super slow. And that's the point. Because this type of breath technique, as well as some other ones that I have, and I have plenty if you guys ever want, just reach out to me. This pushes the body into parasympathetics. That important thing. Okay? So, eyes open, eyes closed, I don't care. Are we ready? So, we're going to do breath in. 1, 2, 3, 4, hold. 1, 2, 3, 4, 5, 6, 7, out. 1, 2, 3, 4, 5, 6, 7, 8. Great job, everyone. So, that's 1 cycle. Hey, you guys. That's only 1 cycle. Okay? Now, what we know, and everybody can take this. I won't make you a selfie. We're done. I'm very proud of you all. I know, for those that didn't know other people, I'm really proud of you guys because I know that's awkward. But again, it feels like there was a good lesson there. But the point is, if we do about 6 cycles, usually it's about 6 cycles of a specific breath work, we trigger the parasympathetics. Yes. Okay? I don't care if it's this one. I don't care if it's box breathing. Most people that have heard of like breath work are familiar with box breathing. So box breathing is 4 seconds in, you hold for 4 seconds, you breathe out for 4 seconds, you hold for 4 seconds, all the square. Perfect. Yep. So when we get that, we do that for about 6 cycles, and 6 cycles again, we'll hit that parasympathetics. So breath work, very important. As you can see, oh my gosh, Colin was 3 there. This is a 3-year-old doing breath work. He's able to do it. Okay?
I do it with my son all the time.
High five. High five. That's the point, and thank you for emphasizing that. They can do it. Especially like when you make it a game and you make it fun and you do these things, they can do it. I understand technology is a thing. I get addicted to it too. It's easy. It's a huge coping mechanism. This will actually prove benefits. Okay? As a quick tangent, he's now 18. My oldest is now 19. When he was 10, he started to show signs of pretty severe anxiety. Cobbler's kid has no shoes. Okay? So I kind of went into a freak out, started checking him a lot more regular in my office, and then we started breath work, and we actually even did some cold work. I do Wim Hof breathing. If you want to nerd out after that, find me. But we did a lot of breath work, and he, and we did some counseling, but if you asked him today, he would say breath work and the cold work that we did was absolutely the thing that got him over the hump at 10 years old and never had an issue. And that doesn't mean he doesn't get anxious. He's an 18-year-old. He still does it to this day, and he's off to college next year. He just goes back to all the tools. And teaching kids these tools, super powerful. I don't know why it's okay. You're doing a great job. You're doing a great job, Lindsay. It has nothing to do with you. I'm sure it was my slides. So the diet and the gut-brain connection. We could hammer this one home for hours. I won't. If you don't understand how chemical stress impacts the brain and the gut, we need to have a hard sit down. I'll take you out for coffee, and then we can have a real big talk on that. But guys, the gut-brain axis, it's a huge connection between the biome in our guts, what we're putting in there, and then how our brain functions from that, right? Most of our neurotransmitters are actually produced in the gut, so maybe we should making sure that we're putting good things in to feed those things so that our body has the proper building blocks to support the healing that we're all ultimately after. Now again, I get it. Everything has been made quick and easy. And in this crazy world, that often becomes a necessary default. I'm not ignoring that. Like again, 2 kids heavily in sports. I have a very busy practice. I'm on the Chamber of Commerce. I'm president of this. I'm on more boards than my wife wants to ever let me be. She will tell you that. And I coach high school. Why not? Sure. There are crazy things. And big food has not made it easy. They have. Food is delicious, right? Like, can we admit that? Like, new food in quotation marks, is amazing. It's delicious, and it's bright, and it's colorful, and it's all of the triggers that our brain wants, and that's why it is the way it is. Sorry if we have any food scientists in here, I'm throwing stones at you. But the reason that it's created like that is for that drive. That doesn't mean it's beneficial, okay? Eating those foods that are going to actually nourish ourselves is super important. Now, how do we get through that? It's a transition, because a lot of these kids are going to be quote-unquote picky eaters, right? Picky eaters. They're not picky eaters. They're eating the things that they like, and the things they like are delicious. Like, they're created to be delicious. They're not picky eaters. We gotta stop that phrase. They just have to be trained back and kind of broken that cycle. Because like if we look at sugar alone, the other white powder, is actually more addictive than that other white powder. Yeah, that's true. There have been plenty of rat studies where they've been given the option of cocaine or sugar, and they get addicted to sugar first. Yikes. So it's going to be a process. Accept that it's a process. It is not going to happen overnight. That doesn't mean it's going to happen, even within a month. It's going to take time, but again, we have to get the proper nutrients in that body. Mental. Routine and predictability. Oh, routines. Again, we go back to those neurological pathways and we go back to that crazy lifestyle that we all currently live with an overabundance of things to do. No offense to anyone here. I guarantee if I asked most of you, because this is what we've all come to do, hey, how's it going? The answer generally is, good. Good's always the first one. Busy, thank you, busy. That is the knee-jerk response nowadays. It's busy. The knee-jerk response is busy. Seconds are good. Good's always the, I'm done talking. But busy is the answer. Everybody is busy. I'm not saying we're not. But I'm also going to throw another theory. Distracted. We're also really distracted. I am. I can, thank you. And you did exactly why. Thank you very much. You raised your phone. I use my phone. I use my phone to create the whole presentation. I use my phone to take notes all the time. I use my phone to do voice memos. I use my phone to watch absurd, silly videos. Like, we can admit that, right? So there's a lot of distraction amongst our busyness. Again, it's changing some of the priorities to get back to that feeling. It's not going to be easy, but it's worth it. So having that routine is beneficial because we're allowing that groove for that neurological pathway to fall in easier. So that if we do a routine of breath work at 9 o'clock every day, because that's the time that we've set aside for it, that's what has to be done. Or if meal for a truly heavily dysregulated child is at 5 o'clock, what's going to happen at 5:01? You already know. It's Pavlovian. Any of you have dogs, right? Like, the dog is there. My dog gets fed at 5 o'clock p.m. He is there at 5:01 if I have forgotten about him, especially because mom is out of town, and mom is his person, and I do sometimes forget. And so he is there at 5:01. Hey, I want my food. Why am I comparing a child to a dog? Well, it's an animalistic behavior. And they go back to that tendency. So using that as a stability mechanism will help with that regulation. Take one of those chaotic factors out. Because especially for kiddos that have gone through a lot of severe trauma, if 5:01 comes and they're fully dysregulated, let's go to the psychology. I've only been talking about physiology. What are they thinking? Thank you. I'm not going to eat. So what is the next knee-jerk response? We don't know. We don't know. That's the answer, right? It's usually going to be some type of survival mechanism. It's going to be a survival mechanism that then goes into panic. And again, for a child that has been built on multiple years or months or however long of freezing, and now they actually have the ability to do something, that's where we get outbursts. Okay, so creating those patterns to the best we can with some sense of reality are going to be really beneficial on the mental state. So, to that, how do we implement it? Because this just probably felt like, he wants me to do this. That's a lot. Yeah, that's the end goal, guys. Again, because I want the best for all of you. I want the best for all the children, certainly ones that you guys are involved with. One step. How do you eat an elephant? One bite at a time. This is no different.
He does, he'll trample on you.
What's that?
He does, he'll trample on you.
I love the witty answers, so thank you. Yeah, it's one bite at a time. This is no different, guys. Okay, so getting one action step, getting comfortable with it, making it part of the routine, getting it settled, moving to the next one. That's the realistic stance. Observe. Some things are gonna be good, some things not. Now you have to give it time, right? Like, again, you put a little roasted broccoli on the plate and child doesn't want it on day one, that doesn't mean that experiment has failed. Give it time, please. But, do you pay attention? Again, we're all on this journey together. We're all learning from each other, that's why we're all here today. So actually observe and track these things. Help your other friends that are doing and going through the same thing. You know, there was a phrase, and it's, I'm not saying 2020 was my fault, but in 2019, I had gotten on my high horse, and I was like, we have gotten away from the phrase, it takes a village. Yeah, like I said, I promise 2020 wasn't my fault, but it felt like a little bit because I put that out there in the ether, and I was like, it takes a village, and we need to get back to that phrase. That's the observe. Because what you do with that information, right, like, what's wrong with me telling Melody stuff that's worked with my kids? I just shared all with you what happened with Alex, that's my oldest son. Should I be embarrassed that I'm a chiropractor working with nervous system regulation and my kid had anxiety? I failed. It's not embarrassing. We're all learning. We're all trying to be better. So doing that is to help all of you and help the next person. Again, it goes back to that ripple effect. Well, if you didn't think I was going to put that third point, you're all crazy. Obviously, I think chiropractic care is obviously going to be highly beneficial. I think it's highly beneficial for everybody, as MC graciously said. In our practice, we've seen as young as 2 days old, and that's usually either at the home after the parents have had their birth, or on the way home from the hospital. We have had parents stop on the way home from the hospital, and that's why it's 2 days up to 97. I think again, nervous system, spine, hopefully everybody has both of those. That's why it's highly beneficial from my stance. Next slide. Hey, I've been talking for an hour. When they told me I was switching from 45 minutes to an hour and 15, my wife laughed and was like, ha! Was 3 hours not an option? And I was like, oh, trust me. They don't know me yet. Maybe they'll give me like a 4-hour block next time. But let's move to questions. And again, if there aren't any questions, that's fine. And again, if you have a question, please feel comfortable asking in front of the group. If you're like truly don't want to ask and you want to ask me solo, I'm going to be here for a bit. I'm not going anywhere. My wife and kids are out of town, so I don't have any priorities. My dog's fed, so that's good. He'd get upset at me if he wasn't fed if I got home. So any questions? Yes.
As a lot of us are dealing in foster cares and stuff,
Yes.
do you and your practice take Medicaid?
We
Or
don't.
does that cover chiropractic?
Yep, nope, that's a really good question. Medicaid, it depends. We don't at my office, and the unfortunate reason is the loopholes and constraints that it puts on the practice. So at our practice, we are always self-pay. We actually don't take any insurance at our office because unfortunately, Medicaid, Medicare, and all insurers have forced us to practice within certain parameters, and a lot of the times, not all the time, but a lot of the time, so I can't say all, they won't provide care unless there's a specific symptom. And chiropractic cares for health and wellness. Insurance does not like health and wellness. Terrible. Again, I want to throw this isn't my microphone, that's why I don't throw it. Otherwise I throw it because it's terrible. Some chiropractors do. I do know one practice that does. So if you want her name, she's a great practitioner in Carmel. She's a phenomenal resource for us as somebody that takes Medicaid and great in the pediatric space as well. So, yeah.
Thank you for giving us such a good description of how the whole central nervous system works and dysregulation works. You mentioned that there were 3 different components in the dysregulation behaviors that you might see. I think you said it was physical, mental, and chemical. Is that right?
Yep.
Okay. So when a person is brought to you and has no physical, which I think chiropractic is bigger than just the physical. but the adjustments that you do are probably focused, and correct me if I'm wrong, on the great assessment that you do initially to decide, is there a physical component that needs to be treated? How often would you say that is the case with the dysregulation, maybe not what you see, but just in general, that there is a definite physical component in the spine or the connections?
Yeah, so going back to the physical, chemical, mental. So the body actually can't differentiate between what type of stress the body undergoes. So whether it's physical stress, and people often say, and we'll go to like a quote unquote normal birth and situation. If that child is born, healthy mom, healthy pregnancy, healthy delivery, why would that child need to see a chiropractor?
Well, you described there are different things.
Thank you. Say it again.
Being born is
Being born is traumatic, yeah, exactly. So
our infant, she slept through the night with us for 5 weeks to 4 months until she went through regular sleep progression.
I didn't even plant MC. She didn't even tell me this was right. Thank you. Thank you, MC. Yeah, so there's always going to be physical, mental, and chemical stressors, right? And there are good, stress isn't bad, stress is good, right? Like stress, we need that whole gravity thing, I'm for it. That is a physical stress on us. And so physical stress isn't the only thing that we're evaluating. Now, how do those stressors impact the body, I think is what you're asking. And the answer is they all impact the body whether or not it can adapt. Like, can the body adapt to the physical stress of birth? Can the body adapt to physical, chemical stress, right? Like, I'm up here drinking water. Water's still a chemical stress, yes. The body still has to process it. It has to then do what it's supposed to do with it. So it's still a stress, a good one, but still a stress. Mental stress, happiness. I sure like happiness, I like laughing. It's still a stress. The body has to regulate it because hormones are released, right? And so the body then has to adapt to it and then go back to its neutral state. And so in that neutral state, it's adapting or it's not. And if it's not, that's what we're concerned with. And it's that lack of adaptation where we actually find pressure on the nerve. And we may or may not actually see a misalignment of the spine, right? Like when we do our x-ray analysis in our older patients, can we actually see what has changed because of it? Yes, but that's not the only how we adjust. Like if we just took an x-ray and we're like, hey, we're gonna adjust there, man, that would make our lives so much easier. But that's not how it goes. That's kind of breadcrumbs for the trail to say, all right, how has the body been handling all of those things throughout the years? Changing here, changing there, changing this disc, changing this vertebra, changing this joint, and that kind of gives us the story, but it's not just the physical remnants of it. Was that it? Okay. Yeah, you're welcome. Yeah.
You talked about helping with like adopted kids or foster care kids, and you were saying like the example for some of the kids that have been adopted like through China, like in China, and they usually put through different things. So say they're now in like an adoptive home, caring for a few years, maybe elementary, high school, something like that. Are you still seeing like the impact of like chiropractor care?
Are there benefits?
Yeah, like are you seeing the impact of like what they when they're young, they're still experiencing maybe some of those negative experiences, and then are you seeing the impact of the work with them?
Just so I'm just going to phrase to make sure that I understand what you were asking. Basically, you're saying, so they got that trauma early on, and we're going to use a baby adopted from China. We'll use that as an example. That then they're under chiropractic care, and are they still getting the benefits from care, or are they still getting?
Well, after being in like a stable caring home, you know, that dysregulation,
Sure.
and being able to have, you know, a little bit more regulated, trying to help
Yes.
that, and then maybe still experiencing some of those stress responses, or maybe
Yes.
that freeze.
Yeah.
Seeing that after they've had years of maybe a stable.
Yeah, we'll call it a better situation. Let's call it that, right? So the answer is yeah. Like, because a lot of those situations are what just kind of happen to come into our office. Not all of them, but a lot of what comes into our office are the cases where they've tried everything else. And things are good, but they're not great. Things are better, but they're not optimal. Things are going well, but mom and dad feel like something's not just buttoned up. Or like, what is the potential for better? Those are often the cases that we see. While I wish it wasn't, and I wish every single patient came in, here's a brand new baby that was born, adopted, fostered, brought over from a foreign country. Please help them and give them optimal. I accept the reality. That's not. So a number of the families are in that exact situation where it's again, we also don't want to wait for said symptoms. Because if we wait for said symptoms, how long have they been there, right? Because again, like so often in other communities, it gets thrown out, they'll grow out of it. Yeah, that phrase, they'll grow out of it. That's not a true thing. They might, quote unquote, grow out of it in the sense that they stop exhibiting said symptoms, but that doesn't mean they're as optimal as they can be. One more? We got one more. Hot question coming in.
So a lot of kids that I've worked with in foster care have very high pain tolerances because of their experiences.
Yes.
Benefits from working chiropractic, and will they have a lower pain tolerance if they're on?
Why do they have, all right, so she asked, a lot of foster kids have high pain tolerances. Anybody want to guess why? Survivability. It's adaptability, right? Yeah, which is adaptation, right? Desensitization. Again, I love that you're reading your dictionary. Fancy word for adaptation. Fancy word for adaptation. Because that body then has to adapt so that it can survive. Again, the body wants to do two things. Didn't talk about the first one. Second one is survive. So if they're going to survive, what do they have to do? Change what's called their threshold. Threshold. Okay, so there are 3 stressors. Fourth one over here that we don't often talk about because it's not a true stressor. It's called threshold. And threshold is how the body is responding to those things. And so for quote unquote high pain tolerance, again, might the body take longer to adapt and come down from that? Yes, because what the body has instinctively and brilliantly done to make that child survive, thank God, is adapt. Is adapt so that whatever trauma was caused, and I won't even throw out different ideas, whatever it did, the next time, not gonna flinch. Not gonna flinch. So will it improve their nervous system input? Yes. Can it impact what's called nociception, so those responses of those pains? Yes. Will it take time?
Yes.
Yes. Okay. Well, MC's looking at me, so that's all I have. If you guys have any other questions, I will be around up here for a little bit, so thank you all for having me.